always feels very odd presenting in this way where all I can see is my slides and nobody else. So yeah, it's an odd situation.
It really is.
Okay, so as I said, I'm going to talk a bit about managing sleep difficulties, and I'll probably refer a lot to children with autism because that's what I made this training about. But a lot of it will apply to children of different presentations. So I think Jill's covered quite a lot of this. We asked people to stay on mute. That everything we talk about in the group will remain confidential, although actually we have to be very aware that there is a video happening, so that's probably not true. Again, welcome to have your video on or off. Use the chat function to communicate, and I think we will catch up with that at the end. And if anything makes you feel uncomfortable, we can have a chat afterwards, or Jill can feed back to me and we can go from there. So I'm going to talk about sleep, consequences, the problems, how we assess sleep, a bit about ASD and sleep, and then some strategies, which I'm sure you're all looking for. So how much do young people sleep? So the research suggests that children need between 8 and 12 hours sleep a night. This changes with children with autism. Some children with autism seem to only need 5 or 6. So I'm sure you're aware that it varies. So sleep problems that we often see are kind of behavioural anxiety around bedtime, needing somebody else present in order to go to sleep, sleeping in parents' bedrooms, difficulties falling asleep, and then waking up and getting up in the night and doing whatever they want to do, playing on computers and things. So the consequences of children not meeting their sleep need is in the morning, you often find it hard to get them out of bed, hard to wake up, feeling tired, irritable and grumpy, sometimes lack of appetite, not hungry, not focused or able to get ready for school, maybe feeling unwell. So if we don't get enough sleep, I'm sure you've woken up before and you sort of think, oh, I've got a headache now, or just don't feel that well and not energized. At school, often poor sleep can lead to difficulties concentrating, remembering information, feeling tired, sleepy, irritable, maybe not performing to their best. And there's often you see a deterioration in what they're able to do at school. More difficulties with interactions. So they're more likely to be short-tempered. Maybe they don't want to join in because they're too tired. It can lead to more aggression and yawning. And then after school, you might see young people being flat, unmotivated, you know, having naps or lying down in front of the telly or on the bed, falling asleep at the wrong time, maybe not engaging in activities. You might see that kind of grumpy behavior and things as well. So what we know is there's a really clear link between sleep and mental health. So if you have poor sleep, you're more likely to have poor mental health. So you're more likely to be stressed, more likely to be anxious, more likely to feel depressed, because that's what the physical signs of poor sleep can cause. But also when you've got those things like stress and anxiety, that can make it really difficult to go to sleep. So it's kind of a bit of a vicious cycle. And this can happen in young people, adults, everyone. So if we're to think a bit about autism and sleep, we all know that sleep problems in children with autism is more apparent. And this is because they've probably got a lot more going on in the day for them that causes them stress. So they've got an increased anxiety. So we know that going to school can be a very stressful time for young people with autism. So there's lots of sensory overload, lots of difficulties around kind of interaction, understanding what other people mean. That can be exhausting, and young people can get overtired almost. We also know that they have more difficulties settling, winding down, going to sleep. And this is because perhaps we don't have the routines in place, or that the young person has their own routine, which is around they want to finish their computer game. And if they can't finish their computer game, they can't go to sleep. And that can obviously cause lots of problems in households. We think there's quite a lot of research showing that the autism has a different brain different chemical balance going on. So that can impact on sleep. And we know, for example, the natural hormone we usually release, melatonin, seems to be released less in children with autism. And so that's what usually happens is when it gets dark outside, our body stops producing that hormone melatonin, and it will make us tired, and then we fall asleep. But what we find is that in children with autism, they don't seem to get that cue in the same way. And I guess if we think about bedtime as well, there's a lot of social kind of cues going on around bedtime. Other people pick up that, oh, this is quiet time, or this is when I've had my bath, I now need to go to bed. Whereas children with autism may not see it as that whole sequence. So they see everything as quite separate, so maybe don't make those connections as well as more typical developing children. So what is the recommended for treatment of sleep problems? So we use something called the NICE guidelines, which is the Institute for Health and Clinical Excellence will look at all the research about different treatments and things, and they will look at all that research and come up with what the NHS should offer and what the best practice is. So what they recommend is that we need to assess the problem and determine what the contributing factors are. So is it that the child's anxious? Is it that there's inappropriate living space that means it's loud and damp? Or is it something sort of biological that might be causing it? Often the way to carry out an assessment is to use a sleep record or a diary, and I'm going to cover a little bit more about that later. Develop a sleep plan to encourage good positive habits, and I'm going to talk about that later. The NICE guidelines are really clear that we wouldn't consider medication until it's really clear that everything's been tried, that behavioural interventions are not working, and then there is a potential medication that can be used. They recommend that it's always consulted with a specialist paediatrician or psychiatrist before using medication, and then it's reviewed on a regular basis. And the child should be referred to an expert sleep clinic if they're observed experiencing any kind of really unusual sleep behaviours. So maybe loud snoring, choking, any or looking for sort of apneas where the airflow gets problematic. So why can't my child sleep? So it can be lots of things that go on in that can affect our sleep. So I expect everybody thinks about the kind of environment that they sleep in, and we want to get things like the lights, the right dimness or off completely. We want to just get rid of noise so that nothing can disturb you. We might be thinking about what the temperature of the room is, and then there's other things within the young person or child that might affect sleeping. So for example, having too much to eat, too much sugar before bedtime, too much caffeine. So lots of young people really like those fizzy drinks that have caffeine in them to help them study, but actually they really stop them sleeping as well. And hopefully young people are not drinking too much alcohol, but alcohol really disturbs your sleep as well. So if we start with a little bit about how we work out what the issue is, so we might use a sleep diary. So this is to identify areas of consistency. So what's working, what the pattern is. So do they go to sleep okay, but then wake up at 2 o'clock every night? Or is it taking 3 hours to get to sleep, but then they sleep until 7 every day? Or are there no patterns, is the other thing. It also helps us to identify areas of praise and positive reinforcement. So are there times in the night that they can actually get themselves back to sleep, but it's the beginning of the night they can't get to sleep on their own? And sleep diaries help us recognize triggers. So I remember doing this with somebody, and the dustbin men came. I used to live in London, and the dustbin men used to come every morning at 4 a.m. at this particular area. And at 4 a.m. that child got up and they had ADHD and they never went back to sleep. And the parents were obviously saying, oh my goodness, they can't get up at 4 every day because then they're tired at 11 and falling asleep at school. But what it was is they were woken up by the dustbin then and then had loads of energy. So we looked at things like earplugs and that helped them to sleep till more like 6. So this is an example of a sleep diary. So you might record the day, the time they went to bed, time they fell asleep, any nighttime waking, what happened at that time. So did they come in? Did they make a noise? Did they settle themselves? Did they need you to settle them? The time they woke up and any naps that had happened in the day, or other sort of at times they might have slept. And that really gives you a sense. Anybody could do one of these for themselves or their child, and it really gives you a sense of what might be causing the problems, or what the problems are at least. And then from there we can think about what needs to be helped how you can help that problem. So I don't know if anybody's heard of something called sleep hygiene. So sleep hygiene is basically about making your sleep clean, because we talk about sleep as being a very important part of our day. And we need to ensure that that there's nothing in the way to kind of distract it, get in the way of sleep, because it's really important for our health, our well-being, and our functioning. So I'm going to start talking about that, and then I've got a bit about anxiety management, relaxation, a slide maybe about medication, and then I know there's lots of questions. So sleep hygiene. So as I said, it's kind of about keeping your sleep clean. So it's different practices and habits to help you have good quality sleep and alertness during the day. So I'm just thinking of an example. I know if I've had a stressful day, lots of energy drinks, been out somewhere buzzing around, lots of music or something, and I come home at 11 o'clock and I'm not tired. And all those things I've done that day have not helped me to go to sleep. Whereas the day that I come home from work, sit on the couch, watch a bit of telly, have a nice meal, maybe have a bath, I'm ready to go to sleep at 9:30. So it kind of depends the setup of how you get set up for sleep as to how well and how easy you're going to get to sleep. So during the day, the sort of things that we could do to help our sleep in the day is cut out caffeine or fizzy drinks. So in adults, it's usually coffee and tea. Chocolate's quite a bad one, hot chocolate. But I think in children and young people, fizzy drinks, lots of sugary energy drinks have caffeine in them. Chocolate, sweets, those kind of things often have caffeine. So we want to cut those out as much as we can in the day. If the young person really needs them, we usually say before kind of early afternoon, so before 2, it would be okay, but not to have anything caffeinated after that time. We might avoid large meals a few hours before bed. So I'm sure everybody can think of a time that they went out to a restaurant, ate too much, and then they're just so uncomfortable, you just can't sleep. So you want to have your meal, at least 2 or 3 hours before you're trying to go to bed. So for a child that, it's often they come home from school time, they're eating 5, 6 o'clock. So that should be okay. But the older teens will come in from school, have a snack, and then eat later, and then snack again at 10 o'clock. And if they need a snack at that time, it's thinking about what it is that will help them to sleep, rather than full of sugary, caffeinated things. So the use of exercise for sleep is really good. So if you have regular exercise, that helps your body become tired at the same time and sleep better. So we always say that exercise sort of early evening, so it's kind of that after school team. It might even, for younger children, it would even be earlier, sort of 2, 3 o'clock after school maybe, to have a run around, or to go to the gym or a swim, or whatever it is that they enjoy doing. And if they did that sort of every day or every other day, or even just a walk, it gets your body into a routine. So then pre-bedtime routine. this is about fixing bedtime. So I know I often hear parents say, well, we've got a bedtime, it's 8 o'clock, but then they go to bed when they like, because there's the computer, there's something else, there's the homework they haven't done, there's all these things that get in the way. But if you can have a consistent bedtime, that really helps. Having a set routine, so having and thinking of children with autism, having a sort of 4 or 5 step routine that maybe you draw out somewhere, so it's the same every night, can really help them to get into that kind of sleep habit as well. So it might be, you know, warm bath or shower, a milky drink, putting on your nightwear, brushing teeth, having a story. I know with older teens, I'm often telling them, you know, you want to turn their bedtime's 10, say, okay, can you turn the telly and the phone off at 9? And that's when you want to read a book or do some artwork or do something a bit relaxing and quiet without lots of stimulation going on. You want to dim the lights a little bit before bed. As we know, the lights cause us to stay awake. So we want, if you aren't producing that natural hormone to make you tired, then you want to reduce it, the sort of physical surroundings. So if you can dim the lights, that's useful. Avoiding overstimulation before bed. So that's thinking about not playing really chaotic, exciting computer games, or not running around chasing people. Those kind of things will just make you sort of overexcited. So it's like my example of going out and listening to lots of loud music, or I'd just never be able to go to sleep when I got in. And you want to cut, I've said this already, cut out the kind of electronic stuff 1 to 2 hours pre-sleep. Now, I know lots of people are going to say, well, you try and tell my teenager that they're not allowed their computer. And I've got a few tips on that, but you're right, it's not easy. So winding down is a critical stage to prepare for bed. So there's lots of ways to relax. So I'm sure lots of people will appreciate a warm bath. Lots of kids don't, but adults certainly do. And that the aim of that is it helps your body reach a temperature that's ideal for rest. So you get really warm, and then you feel more relaxed, and then you feel more sleepy. So it might not be a warm bath they like, but even things like having a sort of hot pillow or hot water bottle around their neck or somewhere, that can just help you feel a bit more relaxed and tired. So for people that get more stressed or anxious, kind of writing a to-do list for the next day to organize your thoughts and clear your mind is really helpful. You often get young people that go to bed and then all they can think about is the work they need to do, or that this friend said this and they don't know what that means and what happened, and they're going through everything in their head. So having things written down somewhere. So there's 2 things. You can either write the to-do list so you're not thinking about what you need to do the next day. The other thing is to write down the things that are worrying you and put them in a worry box or something. And actually that seems to work exceptionally well with children with autism, because it's quite rigid. And it's like you write on the paper, you put it in the box, and it stays in the box. It's not in your head anymore. And I found that has worked really, really well, better than I thought it would. Then the other things to think about are relaxation. So I know these days there's apps for everything, and YouTube videos, and you can get things on sort of meditation, relaxation. One sec. Relaxing music can help. So I know young people that will, you know, pick a piece of relaxing music that they like to listen to. And on the internet, you can even find just scripts about, or you could make one up, about a relaxing place or something and read it to your child. So I've often with young people got them to make up one for themselves, because my idea of relaxation is maybe sitting on a beach and listening to the waves and that kind of thing. I've had young people that have done their own Minecraft world that was very relaxing. It was very much like it has to be relaxing. So what are you building in your Minecraft road? And they were like, oh, I'm building a palace for myself. and there's nobody else in it, and it's this colour. And so it's things we were pulling out the relaxation, but it was within their kind of interests and what they would find relaxing. And what the sort of point of that is that they then can take themselves to that relaxing place. They might want to draw a picture, put it on the wall. And then typical things that we would suggest are things like reading a book, drawing a picture, listening to music, anything that relaxes the mind. So distracting away from those sort of negative thoughts they might have or things they're worried about, but also calming them down. And I think what I always have to say about children with autism is that things that I find relaxing are not always relaxing to them. So it's really important to pick what they find relaxing, but also that takes into account some of these things we're talking about. So you don't want playing computer games because we know that's overstimulation as well. But if they find it relaxing to sort out their Lego into different colours, that's fine. That's a relaxing activity that doesn't involve too much stimulation. So here we go. Here's an example, simple example of like a visual timetable you could use to keep the consistent routine. So you might have specific timers. You can set the timers so that they have 5 minutes to do this, half an hour to do that. You could have an alarm thing that goes off, a buzzer that says, right, now it's time to move on to the next bit. Or you can just use prompts that sort of help them transition. So they come out the bath, here's your pajamas. So they know that's the next thing. The drink and snack is ready. Then the toothbrush is presented to them and they go to the bathroom. Then the storybook's taken back to the bedroom. So there's kind of ways to do it with younger children if they're not good at reading times or don't want to use a sort of stopwatch if that's too startling. And then in older children, it might be about them, sort of young people taking control themselves. So I know there's different sleep apps. I know some people have these smart watch type things. Lots of young people have phones, and you can, I think most of the iPhones come with some sleep monitor thing these days. You just put it on your pillow and it tells you how much you slept. Those things can be actually really kind of quite rewarding for young people to see the changes that might be causing. So if they set it up and do it for a week as their sleep diary, look, I didn't go to sleep till 4, look, I didn't go to sleep till 2. And then the next week trying out some of these things is almost like an experiment. So Mum says I should do all these things. Well, let's try it as an experiment, see if it works. And if they try it and it changes their sleep, and then they can see some positive things that comes out of that, it might be helpful for them, and they might want to continue doing those things. I've certainly used it in sessions where young people that kind of flipped their sleep from day to night, all the time. You just get it back to normal, and then they'd have a bad week and just flip it around again. And we used to use the sleep monitors to try and record where they were at that time, and then use it to what can you do this week to try and increase your sleep? What's worked before, and how can we do that? Visual timetables. So I've said this a little bit already. It's kind of establishing a bedtime routine, using a visual timetable for that. Maybe encouraging relaxation behaviors before bed. So reading a story, doing a bit of art, listening to some music. The other thing I think is really important, I'm sure lots of parents know about this or have done it or tried it or had issues with it, is kind of putting restrictions on things like tablets and computers. So these things are all, I don't know if I know how to do it, but they're all very clever these days. And I think everything can be turned off at a set time. And that just, in a way, reduces the arguments, because it's not you saying, I'm going to turn it off, it just happens. I'm sure it gets a bit of pushback at the beginning, but seems to work, once it's established, seems to work very well. So I think I mentioned this earlier with the picture, but things in the bedroom, it's really important. And I know Lots of young people will be sharing rooms, or there's not the ideal space for them. And so I appreciate this isn't always practical, but thinking about the temperature of the room is important. So I'm sitting in a really hot office and I can see myself going bright red. And if I was to try and sleep in this room, it would be a nightmare. I'd wake up sweltering. I wouldn't be able to get back to sleep. So what they say is that usually the temperature of the room is slightly cooler at night, so that you have your duvet on and you can get to sleep. Trying essential oils, so lavender's proven to be quite effective. So these days you can get those little things that you sort of wipe on your temples. You can get smelly pillows, things that you can put drops on your pillows, those kind of things. So just having that smell around. And also what will happen is over time that association will be bedtime. So you'll smell the lavender and you'll feel relaxed and tired. Use the bed only for sleeping. Again, really hard, particularly in lockdown, where I'm expecting that there's people that have one child in a bedroom, one child in the lounge, and the one in the bedroom sitting on their bed doing their work because there's nowhere else for them to go. But what ideally we'd want is you use the bed just for sleeping. And that's, again, so what we're trying to do is train our body and mind to trigger sleep. And to trigger sleep, we have to have routines that work, smells that trigger that sleep, and also places. So if we sleep in the same bed at the same time, and that's all we do in that bed, then as soon as we lie down in it, we fall asleep. That's what would happen over time. You could read a book in bed if you can't sleep. So that's what a lot of young people will do, is that parents say you have to go to your bedroom and there's no electronics, but you're allowed to read if you really can't sleep. And that's quite important sometimes with children with autism who really struggle and don't seem to need the same amount of sleep. Because what we don't want is somebody lying in bed for 4 hours unable to sleep every night, because that's horrible. And again, some people like this, some people hate it. Children with autism often have particular things they like, but having different background noise. So sometimes the rain or white noise, I've heard people say a lot. Low level talking or music is helpful. Some people listen to wave music all night. But again, it's about association. You have that noise, and that's another trigger that it's bedtime. So if people find it easier to sleep with different noises, then you can use that, as long as they're not disturbing everybody else. I remember working with a young person that was oversensitive to sound and could not go to sleep because she could hear, the footsteps of their parents up, or if the parents spoke downstairs, she heard it. She could hear just a muffle. If somebody went to the bathroom and the door went click, and it was these really, and the mum and dad would say, this is ridiculous. Like, she comes downstairs screaming and shouting, be quiet. We're not allowed to move. We're not allowed to talk. We're not allowed to do anything when she goes to bed. And what we did actually was we explored different noises she could use. And she had the noise of, I think it was rain, but she put raindrops in her room coming down, and then that just muffled the other sounds and helped her to sleep. So being really sensitive to noise, but having a sort of background noise seemed to really sort of help that problem. So relaxation, just check the time. So I'm sure, again, there's lots of apps, and I'm sure lots of people know about different relaxation activities. But things like a breathing exercise is really, really helpful, because I don't know if anybody's tried one before, but usually we're not that aware of what we're doing with our breath. But we're often quite shallow in how we breathe. So we're just using this little bit and in and out, in and out. But as soon as you take more into your lungs and then let it go, it relaxes our whole nervous system, our whole brain. It slows down our heart rate, it slows down the blood flow, and actually it just makes us quite sleepy and relaxed. So learning some breathing exercises to do with the young person, or for them to do themselves if they're a bit older and don't want parents involved, can be really, really helpful. I know that if I'm stressed, I do breathing exercise, and about half an hour later, I'm ready to go to sleep as well, which isn't always good when you're at work. Again, I talked a bit about relaxation music. A body scan, again, you can find, if you Google them, you can find them on YouTube and things. But it's about tensing, it's about scanning your body. So thinking about your feet, tensing all the muscles in your feet for 5 seconds and then letting it go, and then repeating that. And you do it with each muscle group and work up your body. So you're scanning your whole body. And again, that's another really good relaxation. It just makes your whole body feel tired and heavy. So again, that's something you could try in the evening before bed, as a sort of way to trigger sleep. So here's some apps. So we've got Headspace, which I think usually you have to pay for, but there is some free bits on it. There's a kids sleep app, and that's by the Evelina Hospital in London, which is does a lot around sleep. Calm is another meditation app. There's loads on the market, and I think quite a lot at the moment on lockdown seem to be free for a certain amount of times and things like that. So lots of these things are sort of offering freebies to just get us through, get the nation through. So that's my kind of top tips, I suppose, for sleep hygiene. But then what else is going on? There's always other things that could be contributing to poor sleep. So I know lots of the questions that Jill shared with me already were around kind of separation anxiety, not wanting to sleep in your own bed. And that's a real problem. It seems to be more of a problem with children with autism, where they just can't sleep on their own, or there's they need somebody to be there when they fall asleep, and that can happen 2 or 3 times in the night. So I know we're going to have a bit of time talking about that at the end. Worries about school, fears of the dark, sensory sensitivity. So I've worked with young people that did not like to sleep in a bed with a duvet. Their mum was very distressed that most days they found them on the floor, curled up with 6 bits of Lego attached to their body and under the rug, because they didn't want a duvet. They wanted the rug that had the cars that went around it. And it again, that was working with alongside an OT around what we could do about that. And in the end, I think they got a very, very hard mattress and a weighted blanket, and that seemed to help things. So it's thinking about the sensory side of things and what gets in the way of sleep. Maybe physical health problems. So sometimes low iron can make you feel really tired, but can also not make you sleep. Having pains. So lots of young people with anxiety and stress will have tummy pains or headaches, and those things can really affect. And then the environment, which I've talked a lot about. So if it's too noisy or not dark enough, or something else too hot, that can get in the way. So particularly in older young people, we get this cycle where you struggle to get to sleep, you then worry about going to bed because you struggle to get to sleep, then you watch the clock, then you worry a bit more, then you struggle to get to sleep, and it just goes round and round and round, and each night becomes a bit of a battle for parents or a battle for the young person. Worry can really get in the way of sleep. So it could be worrying about not sleeping, it could be worrying about school, worrying about social things, worrying about COVID, whatever's going through their mind. So the worries about sleep are often, gosh, I need to go to sleep, so I've got such a busy day tomorrow, or if I don't sleep, I won't be able to do my schoolwork, or I'm not going to be able to function, you know, and you worry so much about it that then actually you don't go to sleep, and then you always cope the next day, but it's more difficult. Now, an important thing is that we can still function on reduced sleep. It's not harmful. We're not going to be ill or unwell about it from it, but it's not pleasant. Oh, sorry, I've just got a thing in there where I did groups more recently, and my old place where it says next week. So we're not going to talk next week. But we can talk a bit now about sort of worry. So before we do that, or let's just check. No, let's do that just before we do that. So just coming back to the thing around separation anxiety, so I know that's a question that lots of people will have. And it is a complicated one. I often think of it as, so if we think of a young baby, 1, 2, that kind of age, or before even, they learn to sleep depending on how that pattern's been established for them. So if you think of a baby that sleeps in mum's bed, that baby needs their mum to fall back to sleep. And there's always that transition when they move into a cot or a bed or whatever, where that mum might have to do a bit of transitional work, where you may, parents may remember sitting with them while they fell asleep, may remember kind of having to reduce the amount of time they sat with them. And that kind of approach was taken when they were sort of a toddler or something. And effectively what happens when children are a bit older and still need that, still want somebody to sleep with them, it's the same kind of approach of what you're doing. So you might have a child that's really anxious, so you want to work on their anxiety a bit. So you want to help them to feel more relaxed, sort out what the thing is that's upsetting them. So when I said earlier about worry boxes, that can be really helpful. If a child's worrying at night, a worry box means the worry goes in there. The box probably goes somewhere else, so outside the room. So I've had parents say the worry box comes with me and the worries stay with me until the morning. And that kind of thing has really helped them then to sleep through the night on their own, because those worries have been taken away. They don't need their mum because their mum's looking after the worries. That's one kind of thing to think about. And then it's really that kind of graded exposure. So a graded program to remove the mum being in the room. So if there's two scenarios, isn't there? There's the child that has to sleep in their bed. So if we start with that one, you then want to move them back into their own bed. And it might be, to start with, you need to sleep in that bedroom with them. So they're in their own room. You've sorted out the room, so it's, you know, it's not scary. It's the right temperature. It's comfortable. It's all the things that they've said, because often young people say, oh, it's the bed. I don't like the bed. I like your bed. Okay, so we'll then work out what we can do about that. Or, oh, I don't like it because it's green and I hate the colour green. Okay, so we can paint the room. So it might take some preparation to get the room to how they feel comfortable with it. I've heard lots of young people with autism say that they quite like those kind of tented things because they feel more safe, sort of curled up in something, or the use of kind of the heavier blankets, or sort of maybe on a stilts, one of those beds on stilts where they're safe because they're top of the tower. All those kind of things that might help. And then you might want, the beginning of the program would be you staying in the bedroom with them. And then eventually you would stay with them till they fall asleep. And then after that, you would move yourself further away. So sometimes it's, you have to sleep in the bed, like you have to sit on the bed with them until they fall asleep, and then you can move. And eventually you'd be by the door, sitting by the door. I'm still here, with some reassurance. I'm still here, keep going to sleep. And then you move outside the door, and then the door gets closed a bit more, and then you're just upstairs while they're trying to get to sleep, and then eventually you can just get on with things. So that's the process. I appreciate it's really hard to do, and there's a lot of, so it's a lot about consistency. I've worked with lots of parents on programs like this that have taken months, and as soon as they have a bad night where it just goes, forget it, just come in with me, it sort of goes back a bit. So it's really, really tricky to do. So where did we get to? So what you might want to do is about making a sleep plan at home. What changes could you do to help your young person sleep? So is it something to do with the routine at the beginning? Is it tackling the separation anxiety? Is it giving them rewards for sleeping through the night, sleeping in their own bed? What can you use to motivate them? That's a really important point. And with young people, it's harder. I appreciate it's harder because they've got their phones and they want to be on their phones with their friends. And also at the moment in lockdown, really tricky because you haven't got that routine. Lots of young people are not doing anything. So then you kind of lose the ability to need to tell them to switch off their stuff because you know there's nothing else going on, and they're sleeping all day and up all night and all their friends are doing the same. So then it's really challenging. So I'm highlighting the challenges, don't have all the answers. So the key to success is about, I said this already, persistence and consistency. So we know that children's sleep patterns don't change overnight. At minimum of 4 to 6 weeks to get you back into a new routine. So just thinking now, they're talking about schools going back in March. Now, whether they will, we don't know, but you probably would, if your child was up all night now, you'd probably want to start thinking about getting them into a school routine again, because that's about, we're talking about 4 to 6 weeks, aren't we? So that's the kind of length of time that you need to be persistent and consistent with it. And even then, you may only see some small changes, but changes in the right direction, I hope. Always try and involve the child. So you want to sort of, if you're trying to get them to sleep on their own, how are they going to be motivated to do that? So they might be 6, 7, and you might be thinking, right, come on, we need to get them in their own room now. And you might be thinking about how this is a really big boy activity to do, that all your friends do it. You know, what can we do to make it special? How can we make your bedroom better? What rewards will you get? Well, if you're able to sleep in your own room, there's other grown-up things that you wanted to do, like go to the I can't think of anything, you go swimming on your own, and now you're allowed to do that. Maybe we can consider that as an option. So it's sort of thinking about what will motivate them. And of course, children, young people will probably resist at first, but it's maintaining those boundaries and being persistent with those interventions. Okay, and that's what I've got.
That was great. Thank you, Laura.
Shall I unshare now?
Yeah, that would be lovely.
If I could do it. Stop share, found it.
Perfect.
There we go.
Wow, that was a lot to take in.
Yes.
But thank you. I think personally, thinking of my kids and my 9-year-old, she is now, it's having that consistency. We've got really slack at trying at bedtime because, you know, she's not going to school and she's really bad at switching off. And I think it's remembering I'm the parent, and actually there's going to be an element of you have to toe the line. I
completely appreciate that. And I just sort of think it's probably almost, when we set this up, the wrong time to be doing this, because everybody at the moment is in a sort of let's just get through it phase, however we can. And so you need to be strong to do this kind of like change and intervention. It might not be the right time to do it. And that's absolutely okay.
No, absolutely. Thank you. I've had lots of questions. I'm aware that people might have questions themselves now, but can I just ask a little bit about medication? Because that's something that we get taught, you know, people are always asking about melatonin and the, you know, when that's the right time to have it, on how it works and how it works as the children get older. So just any thoughts around that might answer a few questions.
Yeah, so melatonin. So I don't know if people are aware that at the moment it's quite difficult to get hold of. CAMHS no longer are kind of able to prescribe it as the only thing that they're doing, unless it's part of a wider presentation around mental health. It's the GPs can't prescribe it usually because it's not a licensed drug for this use in this country. But having said that, it's quite a safe one, and in other countries you can buy it over the counter. So what I would say about it is what it's actually doing is it's helping the release of that hormone that makes us go to sleep. So it definitely has some benefits in children that really struggle with going to sleep, but there are also a lot of behavioural things that we've talked about today that need to be tried first. And a lot of the time, by changing a routine, by giving them activities they can do. So sometimes it's about our expectations as well. So we may expect a child to go to bed at 8 o'clock, but actually a child with autism finds that really, really difficult, because actually their sleep kicks in at 10. Now that's fine, but you might want them to have quiet time in those hours, in their bedroom, reading, playing quietly, and you just come up to turn the light off at a certain time. And I think if that's part of the routine, that's completely acceptable. And if that helps them get to sleep, then that's great. Yes, medication is useful for getting to sleep, but it doesn't keep young people asleep. And you certainly wouldn't use it if they wake up in the middle of the night and can't go back to sleep. That's about thinking about how much sleep they need and what's appropriate time to go to bed. So, for example, if you've got a young person that you put to bed at 8 and they try to get to sleep at that time, and then they're up at 2 and that's it, they're functioning and they don't ever need to go back to sleep, then what you're working with is 6 hours. And so you might want that child to go to bed later so that they sleep 10 till 4 or 11 till 5, because you can't change a young person's kind of amount of sleep that they need. You can try and encourage it, and you can try and help that, but I do hear a lot of the time that young people with autism sort of only sometimes need 6 hours, and then it's finding appropriate 6 hours and what you're going to do with the other hours that you would rather they were asleep but they're not. Maybe it's quiet time in their bedroom. So I've had young people that wake up at 4 but they're not allowed to go and talk to anybody until 6:30. And
yeah, we have that
Lego obsession, and they can get up and play with their Lego and that's fine, but they can't do anything else. They can only go to the bathroom.
Yeah, absolutely. Helen's just said on the chat thing, if melatonin is not licensed, will a GP prescribe it when a child hits 18?
Is it? Oh, gosh, do you know what? I don't know about 18. I don't know about adults. I think you can get different ones for adults. I think the problem is that a lot of these are not licensed and recommended for children. But we know there's some research about melatonin in children with neurodevelopmental disorders. But yeah, I'm not sure. I think 18 you can get sleeping tablets, can't you? You just can't.
Yes, yeah, you can get slightly
higher ones,
more effective things. Yeah, absolutely. Thank you. Does anyone else have a question that sort of hasn't been covered already? Just pause for a minute. Oh, Helen, I can see your hand. Oh, that's nobody's ever put their hand up before. No, that's great. Thank you.
Sorry, no, I asked about the melatonin. So obviously my concern is my daughter is on melatonin and risperidone to sleep.
Yeah.
And she hits 18 in May. Mm-hmm. And obviously we've been told we won't be under adult services, and she goes off to university in September. Right. So I'm like, what happened? You're saying that, oh, they might change the drugs. Well, actually, she's been on she's used to that, and the fear of them changing the drugs now.
Yeah. I expect it's okay for 18 plus. That would be my guess. Most of these things, it's a problem in children because the research has never been done in children, so therefore they can license them. I'm guessing that you're under a psychiatrist somewhere.
Yeah, we are at Eastleigh, yeah. But obviously we've been told she will have no mental health service when she hits 18. Yeah. So obviously I'm petrified. She's on these medication. Where do we go? Where do I go if we want to come off them? She literally sleeps 12 hours a day now if she's not at college. Because
I'm sure the GP would be able to continue that, and if not, then they will think about what needs to happen next. It's very difficult when these young people turn 18 and the services they've been getting then are not the same, and there's different criterias and different
we find quite often that once our sort of young people hit 18, if there's an issue where they would need to see somebody from adult services for sort of medication adjustments, then the GP makes a referral back in, and you have to sort of go through the system and have a chat then, and that's how you can get medication adjusted or prescribed. You can have sort of a one-off appointment with adults. They can set up what's going to happen, and then that goes back to your GP to sort of prescribe it. So it does.
Okay, I mean, obviously my concern, she's off to university and you change GP and all in 3 months of her 18th birthday. So it's quite a scary thought, you know.
Absolutely.
And I expect whoever the psychiatrist is would say, this is stable, this is what is working at the moment, please continue to prescribe. And then it might be a year or two down the line when actually it's not working anymore, or you want to review it, that then exactly what Gio says, they would make a referral to the appropriate adult service for that. But I'm sure, I mean, I'd be shocked if they say, right, she's 18, she's discharged from CAMHS, stop all those medications, you're not getting anything. They wouldn't do that.
Yeah. Thank you.
Okay, thanks, Helen. Right, I've had a question pop up from Mandy that says she has a 6-year-old who she co-sleeps with because of attachment issues. She tried for a month doing the method that you said, Laura, but she wakes up and is back in her bed again, and that can happen quite a few times in the night.
Yeah. And I think the bit I forgot to talk about is what happens when that happens. And it's like, so I'm assuming it kind of worked to begin with. So the going to sleep, it worked, but in the night she gets up, and it's actually then doing that again in the middle of the night. So doing the whole routine of sitting with her to get her to sleep, to then grading that out of the bedroom. And so over time, she would learn that actually she can get herself to sleep. But it's kind of a habit that hasn't yet been worked on, if that makes sense. So it's really challenging, because we're basically saying to you, you are going to have some really disturbed weak sleep to get that sorted. And it again may not be the right time. Maybe you don't need to do it. It's, that's your decision.
It's a really tricky one, isn't it? Really, really tricky, and so disheartening when they think you've cracked it and then they suddenly pop up.
But it's really positive that you've managed to crack the beginning bit, because
really
it shows that she can learn and she can do it, and that with consistency she's doing it. It's just having to then do it in the night as well.
Yes, it's so tiring. It really is. And if we've got any other questions from the group, I'm always aware that whilst people send questions, I think we've covered an awful lot of the questions that were sent over. And it might well be, I know, Laura, you're going to be one of the team doing our autism advice clinics over the next few weeks. So if you have sort of questions that come up from this, feel free to book into one of those chats and come and sort of ask Laura for a bit more detail about something that may be going on. It might, feel more comfortable to sort of talk privately. Then I'm really happy for people. And
I can send the slides to you, Jill.
That would be great. Thank you.
And I've had a lot of information in them.
And I've had lots of people ask if they can watch the video afterwards, which is why we record it. Lots of people that can't make it for various reasons. So that would be really useful. I'm not going to go through sort of the long list of questions I had, because I think we've covered most things. Just before we finish, was there anyone else who had any final questions? No? Give it a moment. Okay, well, Laura, thank you ever so much. I think it's been really useful, and it's made me just think, actually, I need to just get a bit better at doing some of this with my kids. You get a bit slack after a while, because it's tiring. But I think it's just useful to be reminded of some of the things that we could be doing and trying. So thank you ever so much for your time and for coming along, and thanks everyone for joining us this morning. It's been really helpful, and I hope other people have found it useful. So thanks everyone. We'll see you all soon. Thanks. Bye.
Bye.